Hello everyone, welcome to Move Well, Live Well. We get a number of people that come in here with issues regarding their knee, and they complain of pain in the knee at night, almost like if it's a kind of like a deep, dull, nagging ache, almost like a kind of a toothache discomfort in their knee at night, and it's not, and that's kind of the only time that they feel it. As it progresses, sometimes these folks get problems in their knee where it buckles on them. So they'll be walking or something, and then the knee will just kind of just give out, and then sometimes they fall down. That's the progression of this problem here in the knee. People who do squatting, people who are squatting, athletes, that type of thing, when they go into a squat, sometimes as they come into a squat, they'll feel pain in the knee, and then they'll want to shift to their left side because of the pain here on the inside part of their knee in this area here. And it sometimes even refers all the way into the, kind of even into the groin a little bit, the adductors, if you will, the inside part of the thigh. So as they come up like this, they feel that pain in here, and then they'll want to shift over here. They'll do a hip shift to the left to make it all the way up to the top. So what's going on here? What's happening with their knee that they're having these problems? Pain at night, progressing into a point where it sometimes buckles on them, and when they do their exercises such as squatting, they do a hip shift because of the pain on the inside part of that thigh and that knee. Well, what's going on here, they have developed issues with this teardrop part of their knee called the vastus medialis. It's this teardrop shaped muscle here on the inside part, kind of the inside anterior and medial part of the knee, of the thigh right here. And they've developed trigger points in there, and it's causing that deep pain at night. It's causing that buckling when they walk, and it's also causing that discomfort when they go into their squat. And as they come up, they feel that sharp, almost like pain in the inside part of their thigh, and they have to hip shift to continue doing their movement. So how do you fix that? How do you fix this junk part in the inside of the knee? Well, you can do two things. This is a great tool. Costs you a few bucks over at the supermarket. This is a good old rolling pin. What you do is just right here in your knee, just above the kneecap, you just search around for that nasty parts of the vastus medialis. That tacked down tissue, like right there for me is, ooh, that is a sucker. So right in here, that's really tender for me. So when I find a good spot, I just oscillate back and forth on it right there. Just oscillate back and forth. And I usually recommend you start distally and work your way proximal. So that way it aids in venous return. Remember, your veins have one-way valves. You want to aid that going towards the heart. So you're in here. So this is a really nasty spot for me right in here, just like this. Right in here, just like, oh, right there. Oh, that is nasty right there. Hoo-wee. That's a good one. Now, and then you work your way up toward the other parts of vastus medialis, but find those, search around for those tender ones and just oscillate back and forth on them until they become alleviated. Do that a couple times a day, every other day, and that'll help with your knee. Another way you can do it is you get a good old barbell. This is just a 9-pound, this is your standard barbell. You know, it's not the Olympic barbell. This is the, I think the 1.5 inch diameter barbell. But anyway, this is about a little over 10 pounds. And what you do is you lay kind of on your side here a little bit like this, and then you just roll this back and forth. This is kind of like the lazier version of it, because you're allowing the weight of the barbell to do this for you. And as you can see, I'm just kind of using my fingers to bring that back and forth, like right there. That's a spicy spot for me right there. Oh man, and I'm just gonna oscillate back and forth on that spot right there. Ooh, man, that's a good one. So that's the vastus medialis part of the knee. Now the vastus medialis, like I said, people having problems in here, pain at night in the knee, kind of like deep in the joint. They're getting pain in there. As it progresses, they can get to a point where it's buckling on them. So they fall down because of the buckling in the knee. And people who squat, they're doing squats, and then as they're coming down, they feel that pain, kind of this inner part of the thigh here, and it's coming from the trigger points in the vastus medialis portion of the quadricep muscle. So, 2 ways you can do this, and as you get more, as the sensitivity decreases, you can add more weight. You can add a heavier barbell, for instance. You use a 25-pound barbell or even an Olympic 45-pound barbell on that part of the vastus medialis. But I'm a sissy, so a good old 10-pound is good enough for me. Well, anyway, if you have any questions with this video, obviously drop them off in the comment section below. We thank you for watching. We appreciate it. Please give us a thumbs up. It lets us know you care. And if you're new to this channel, go ahead and hit subscribe. And when you hit subscribe, make sure you hit that bell notifications button. That way you don't miss any subsequent videos coming here in the near future. That way you can continue to move well and live well. And I know you know people who have knee issues. Share this with them so that way they can continue to move well and live well. Anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care.